we found a 5 centimeter polyp in the sigmoid colon, and the biopsy showed tubular adenoma. So he is scheduled for sigmoidoscopy with endoscopic submucosal dissection.
Laterally spreading granular type and nodular mixed type, which is generally we try to do en bloc dissection. In the rectosigmoid colon here, you can see even after injection and dissection slightly, the submucosa doesn't open up. So you will see some of the cases like this that difficult to enter the mucosal flap. So what we done is we change to the ST hood, which make it easier to open. So we were able to open slightly, and we already done some work here. So next thing we are trying to do now is to level the area. Just like if you're gonna do one pocket, just this one pocket is enough, or one tunnel, doesn't need multiple tunnel.
Is you got to make sure you get into the submucosal space. Once in the middle of the procedure, especially when you're doing a pocket technique where in a way mimics a poem, you're in a more enclosed environment where the water injection and the injection through the ProKnife probably suffices.
This is not it's over the four, so it may not look, you may not appreciate it, but when I put air complete to distend it wide, there's going to be a four sticking in the center. So this is difficult to close with just clips alone. So we are using the HITEC from Boston Scientific. Gentle forward, push. Because you can see the slight submucosal fluid, I need to penetrate the tissue more. Okay, close. You can see it's turning to going inside into the tissue. And sometimes you see the scroll like that. Okay, continue to turn 3 times. That will sometimes make it difficult to see how deep it's going in. But I will just keep forward pressure now to get it as deep as possible. Floyd?
Could this
sorry?
Could this wound be also closed with the mantis clips or with the dead clip?
Yes, I think mantis will also work. But if I can make it come together, it will be easier with the mantis. So from the very wide defect, now the center come together. But there are residual defect on the right and on the left. But now it's manageable with clips. If I see that the distance is really wide, high tension over the fold, I would prefer to use HITEC first to make it more secure. So this is like the scope start to loop. So adjust and then put the clip. Maybe this clip might be superficial, but I grab it. I can put more clips to reinforce to make it more secure. So after we put the total of 4 clips, this is the last clip, and this is a more difficult because it's at toward 12 o'clock. And you can see the complete closure. We look at try to see if there's any space left. So it's complete closure with one HITEC system and 4 clips. This is a specimen almost 6 by 5 centimeter.